Good morning, and thank you so much for joining us for another virtual community town hall. This is our fourth. I'm Jim Skogsbergh, President and CEO of Advocate Aurora Health, and we're pleased to be with you today. I'm grateful to have an outstanding team of pediatric physicians from Advocate Aurora Health with me today to help answer questions and provide tips on the pandemic's impact on the mental health and general health of our children. Wow, who would have thought back in March when this pandemic began that we would still be facing such a significant challenge and changes in our lives as a result of the virus this fall. Today, some 6 months later, we continue to see COVID-19 cases spiking in many states across the country, and most recently in Illinois, we see cases sort of holding steady, while in Wisconsin, particularly in the north, we're seeing case rates increase. In response, schools are doing the best they can to adjust, some with in-person classes, many more with online or hybrid options. Since there is no immediate end in sight for COVID-19, your new normal looks much like our new normal at Advocate Aurora. Our Safe Care Promise includes screenings, you're doing that, masking, social distancing, enhanced cleaning, and virtual check-ins. We all benefit from these protective measures that will help protect us from the virus spread and halt it, hopefully. And while no doubt parents and caregivers should be applauded for doing a great job, all of us can use a little help in navigating this complicated world from time to time. Our pediatric experts are here to help with that. They are among the best in the field to provide insight, advice, and guidance for you, our viewing audience. So a few quick housekeeping notes. First, please submit your questions and comments below, and we'll try to answer as many of them as we can in the time that we have available. Next, if we run into technical difficulties, and we certainly hope we don't, we'll make this video available on our Advocate Aurora Health Facebook page for later viewing. We'll also have closed captioning when we push this out tomorrow. And finally, please take the survey after the Facebook Live event to give us your feedback. It's very important to us. We plan to do more of these, and so your feedback is going to be valuable. Here to help you as parents, grandparents, relatives, neighbors, caregivers, here to help you navigate these issues and answer your questions today is our panel of physicians and experts who are also, most of them, parents themselves. Let me start by introducing our physicians. When I do, let's take a few minutes and ask all of you to introduce yourself to this audience. Dr. Dahlman, why don't you go ahead and start, if you would, please.
Absolutely. Thanks, Jim. My name is Kevin Dahlman, and I did my residency at Children's Wisconsin. I've been with the organization for 12 years. I practice as a pediatrician in the greater Milwaukee area, and I currently serve as a physician leader overseeing Aurora Children's Health.
Great. Thanks so much for being here, Kevin. Let's see. Dr. Vandervallen, would you please?
Certainly. My name is Malcolm Vandervallen. I'm a child and adolescent psychiatrist in Park Ridge, Illinois, affiliated with Lutheran General Hospital. I did my residency training at Lutheran General Hospital, actually, and then I did fellowship training in child and adolescent psychiatry at the University of Chicago. I just started with Lutheran General as an attending physician in July of this year, and happy to be on board.
It's great to have you. Thanks. Both at Advocate Aurora, but also here today as well. Thanks for being with us. Dr. Roberts, Gabriella, would you please introduce yourself?
Hi, I'm Gabrielle Roberts, and I am a pediatric psychologist at Advocate Children's Hospital in Oak Lawn. And I'm originally from Detroit and did my training at Boston University and the University of Texas at Austin. And around my house, I am known as Mama to my 6-year-old daughter.
Very good. Mother of one. That's great. Let's see. Dr. Moore, you're with us, a general pediatrician. Please introduce yourself.
Hi, I am Dr. Moore, and I'm a pediatrician for over 10 years. And I also trained at Advocate Lutheran General, and now I'm practicing with Advocate in Chicago. And I'm also a mom, but to boys, 2 boys, 6 and 4.
You guys could talk a lot. The difference between the boys and the girls, yeah. I got a little experience there myself. Veronica Vallejo, you are with us today, and we are so pleased to have you. Please introduce yourself.
So my name is Veronica Vallejo. I'm an LCSW, and I function as the pediatric psych liaison at the Children's Hospital in Oak Lawn. So I cover the medical floors. And I've been in this position for approximately 7 years and in practice around 20.
Very good. Well, listen, panelists, thanks so much for being here today. I also want to mention that all of us came into this session wearing masks. We all wore masks. We took them off because we're now 6 feet or more away. And we want you to know how important masks are. I'm sure there's going to be lots of questions about masks in helping us stop the spread of this virus. So with that in mind, let's begin. The first question, Dr. Vandervala, goes to you. Sure. What is the impact of the pandemic on children and their mental health and wellness?
So I think it's important to remember that this pandemic has affected everybody in different ways. So, just like with adults, children are affected in different ways from child to child. Depending on the age of the child, depending on the personality, their pre-COVID routine, we're going to see different struggles, challenges, impairments in this day and age. For example, younger kids may actually see this as more of a positive. They may like spending time with their families. They may like the fact that everybody's at home all the time. They may be seeking more attention. Older kids, teenagers, adolescents, maybe not so much. They might not be enjoying this as much. They miss their friends. The pandemic is taking a lot away. I think overall we are going to see a lot more behavioral concerns and issues as we kind of go through this and as kids are navigating and kind of trying to figure out this new normal. Fortunately, kids are resilient at baseline, adaptable, and I think we're going to see them continue to improve as our circumstances improve as well.
Great, thank you. Anybody want to add to that question, any responses? We got plenty of questions, so I don't want you to feel obligated. Kevin,
Sure.
You're starting to say something?
Yeah, I'll chime in. I really appreciate that response, and I think it's right on. In our practices, I'm sure that as pediatricians and the psychiatrists have seen and really appreciated the uptick and the amount of anxiety that a lot of teenagers are experiencing. I mean, my heart goes out to them. It's a difficult time because it's really a paradigm shift in how we live our day-to-day lives. And that social interaction in person is so critical for healthy mental health. So we really have to innovate new ways to be able to achieve that level of healthiness.
Good comments. Next question, Dr. Roberts, for you. Whether children and teens are going to school in person or virtually, school has been disrupted in a big way. What can parents do to help them transition to this new normal? Boy, a new normal is the most overused term we've heard in the last 6 months, but it's true. It is a new normal. So what do you think, Gabrielle?
I think that and uncharted territory is the other one.
True.
Yeah, I get this question a lot. I think it's one of the big questions of the hour. I think it's overwhelming to all of us, myself included. And so I have found it helpful when I think about it to break it down into 3 parts. Foundation. So laying a foundation, preparing for what's to come, and responding to concerns. So foundation, preparation, and response. When we build a house, we have to first lay a strong foundation. I think we all learned from the 3 Little Pigs that you don't want to build a house out of straw, right? So the same goes for our children. We want them to be as strong and healthy as possible, mentally and physically. We do this by ensuring they're getting a good night's sleep, eating a healthy diet, and making sure there's time in their day every day for fresh air, exercise, and fun. We also want to strive to maintain consistent routines, whether they're attending school in person or remotely. This includes things like bedtimes, meal times, recess. I know this is difficult and it is not going to be perfect, but we want to try because routines offer a sense of safety. So preparation. There are so many unknowns and it's overwhelming to all of us, but we can help our children by communicating with them about what we do know. Language is so important here and change is so important to talk about. So we want to talk about change as the norm. If we talk about it and we expect it, it can feel a little bit less scary, kind of like it's part of the plan. And we want to talk about what might cause things to change, what that will be like, and how we'll adjust, and also help our children prepare on a daily basis for any changes that arise with school or at home. And finally, response, helping our children with all of their thoughts and feelings about all of this. We want to listen, we want to talk to them, we want to validate that feelings of sadness and anger and worry are very normal right now. Help them develop coping skills, help them problem solve through difficulties. Don't be afraid to ask for help from a teacher, a school counselor, a mental health professional. We want to help them focus on what they can control and try to build, as parents, we can build in choice where we can. And we want to emphasize that this will end. I keep saying that. It feels empowering to say something you can say for sure. It will end. We don't know when, but it will. And in the meantime, our goal or our mission is just to make this a good, different, and hopefully never to be repeated again, but good school year.
You know, you said something that I want to turn over to all of you collectively, and I'm asking out loud, is there a light at the end of the tunnel? Is there a bright light? And you talked about if we teach our kids coping skills and the ability to adapt and change becomes something that they're accustomed to and comfortable with, we're really building resiliency in our youth, aren't we? And that's a good thing. So we're trying to find, sort of make lemonade out of lemons and so on, but I could see where that would be a positive, if we do it right, and that's why the viewing audience is with us. So you would agree with that general statement?
Absolutely.
Veronica, let me go to you next. It's boring, here we go. It's boring for children and teens in this stay near home environment, and many are getting a lot more screen time than usual. Is that bad for them over the long term? So our kids are buried into the screen, good or bad? What do you think?
I think we got to put it in context, right? And just kind of recognize that under these circumstances, that is what we're going to have to do. But approaching it with a balance. In recognizing that for some of those that are doing virtual school, that's a purpose. It's some way of getting something done. Also interacting with their peers, with family that they're unable to do otherwise. So I think approaching it in the context of this is what we're going to have to do for now. Creating a schedule. This is, the time that we're going to allot for school. This is, dates and times that we're going to connect with the people in our lives that we're missing. Even using it to connect, doing fun things like, exercise, getting some type of routine with that, but also giving them an opportunity to have fun with it too. So again, going back to that concept of having some type of balance, but also with the schedule, having an end time. Like you want to be reasonable with a cutoff time, especially as you approach bedtime in order to kind of create that, kind of normalcy of, okay, we're done for the day.
Right, yeah. Additional comments?
Yeah,
please.
I would add to that I agree with everything Veronica said, and I would, we all know that time spent online for school is very different than time spent online for socialization, and as she pointed out, that's really important. And I would just emphasize what she said about another highlight of the schedule or another benefit of the schedule is if you put other things on the daily routine or the daily schedule, like exercise, like fresh air, and other activities that are non-screen related, you can, at least as a parent, have some assurance that your child is engaging in activities off screen. So even if screen time as a whole is greater, they're getting some other good, healthy things done in the day. So having that schedule and that routine gives you that. You don't have to worry every day. You know what's happening. Schedule
and routine, kind of a common theme. Kevin, if I can ask you, one of the biggest traditions that could be disrupted in a few weeks is Halloween. Should our kids be going trick-or-treating? Yes or no? What are you advising?
Well, I'm going to advise, at the risk of being a Debbie Downer, no. To be clear, I think there are other great ways that we can celebrate, and I think we can get really creative with like virtual, dress up and costume parties. I think we can certainly celebrate in other ways. You can have pumpkin carving with our kids, and my kids always love doing that. But unfortunately, this isn't really the time and the best season to be trick-or-treating because there's so many unknowns. Granted, yes, it's going to be really quick contact with the houses that you're visiting, but at the same time, you're going to have possibly 20, 30, 40, 50 exposures, how many trick-or-treaters you have. Of course, for the trick-or-treaters, the risk is who's answering the door, and then the virus on the candy. There's not a lot of evidence to suggest that it really stays on the candy. We don't know for sure. So we want to be really careful. Of course, then kids often mingle when they go trick-or-treating. It's not a good setup. The CDC does say this is a high-risk activity, so I would say let's come up with alternative ways to celebrate this fall season.
Are you all advising your patients similarly? I imagine right now that's probably a common question that parents are raising up, correct? And so you're all in the same boat, like, hey, not this year, right?
No.
Does that mean I have to eat all the Halloween candy in our house myself? Yeah.
Well, I heard a radio show where the DJ was suggesting that the children all just sit on the lawn and that the cars drive by and throw candy at the kids.
Yeah, great one.
So there are other options, creative options.
We do get creative, don't we?
Or
Yes, indeed.
scavenger hunt, too.
Yeah,
Scavenger hunt.
Yeah.
Dr. Moore, next question for
Okay.
you. We're talking about mental health concerns.
Okay.
But what can we do to keep our children safe? And the question really has to do around the flu shot.
Okay.
I mean, is that sort of the beginning of, hey, there's all kinds of issues out there, but let's at least get a flu shot for our kids?
Yes, well, because COVID doesn't care that flu likes to shine between October and May. And flu doesn't care that COVID is still here. So what we can do is still get our flu shot. And the goal is to get it by the end of October, because it takes about 2 weeks for your body to build antibodies. And then sadly last year, about like 180 kids passed away due to flu-related deaths. So that is very sad. And then kids also have a higher risk of hospital stays due to the flu. So one thing that we can do is to get our flu shots, hopefully by the end of October. And then Advocate also offers our Safe Care Promise, as you already mentioned, where we have enhanced cleaning, we have screenings, mask requirements, and we also offer virtual visits. So that with the flu vaccine, and then also when you get home, take off your shoes, coat, and wash your hands. That's what I always tell my boys, and they get it most of the times.
So this flu shot, the flu vaccine, and you know, lots of discussion about COVID vaccine. Let's stay on flu for a moment. Those deaths that you talked about, completely unavoidable. Yes. Do you, as clinicians, see any good reason for our kids not to get a flu vaccine?
No, even if they have an egg allergy, they can still get the flu vaccine. So,
are you all on the same page with that? I mean, the idea is, boy, there's just no excuse. Get a flu vaccine. Is that a general statement? Do you agree with that?
100% yes. It's so critical to be protected against the flu. Granted, we're hoping for a better flu season this year because of masking, social distancing. If Australia is any indication that it's a better season, but still, there's no excuse, to be very clear, not to get your child's flu vaccine.
Yeah, and I just think there's value in being direct and strong about these recommendations. Not everybody's going to follow them. We know that. We're all raising our own kids in our own way, but getting the advice from the experts about, boy, go get that flu vaccine. Thank you.
That's anybody that's 6 months and then older.
Yeah, thank you, 6 months and older. Okay, some more questions here. I'm going to open it up. We have a newborn baby. Should I still be keeping her away from extended family and the public for now? What are you advising newborn babies? Stay out of the public for a time being, or gently introduce family members? What do you think?
I think that we need to use virtual visits more because a newborn doesn't have an immune system yet. And as much as people want to see them, they always want to touch them or kiss them or hold them. And particularly now, it's not a good time for that.
Is there an age in which you're saying, hey, it's kind of okay to let up a little bit, or do we not let up at all?
So in fact, this is true for my practice in COVID or not. Usually until we have those first set of vaccines in at 2 months, I do recommend that we try to hold back on visitations. Certainly, immediate relatives, close family can visit the newborn, but we recommend hand washing and whatnot. In the context of COVID, if you can keep that separation even more for longer, the better. But I would say this isn't the great time to pass your child around the pew at church or anything like that. We want to make sure to protect that newborn. And I would say after 2 months, we generally let up a little bit with those restrictions.
Okay, thank you. Next question. How do we talk to small children about this pandemic when they ask, when will the germs go away? How long will we have to wear masks? Is there any advice or guidance about dialogue with little kids and sort of how we speak to it?
So I know, like, for me personally, I've got 2 little ones at home. So for my 3-year-old, she's kind of asked questions about why we can't go out and why we're not going to the park as much and not as often. So I think it's important to be using developmentally appropriate language to start with. So we're not going to get bogged down on using terms like the virus and coronavirus and all these kind of scary terms and things like that. So, I try to keep it really simple. People are getting sick, and masks can help us make people not get sick, and it can help you from not getting sick. So I think it's really key to kind of meet the child where they're at developmentally in explaining those types of things and trying to do it in concrete ways that they can understand.
Yeah, thank you. Any other additional comments?
I would agree. I think this question is so important because on both ends of the spectrum, I hear from parents who have children who are asking questions and they're not sure how to answer them. And then I hear from parents who are wondering what their children are thinking and feeling, and the children aren't saying anything, but they're afraid to ask because they don't want to introduce fear, so to speak. And so I'd say in either case, checking in is good, and asking open-ended questions to check in with your children is so helpful. And I agree with what was said. We want to give information that's age-appropriate or developmentally appropriate. And this will mean, by the way, that if you have children of different ages, the information you offer them may look a little bit different. And I would add a couple other things. I would add that as adults, we tend to prepare to give children more information than they really want or sometimes need, and that can overwhelm them. So I would say take a less is more approach to start. So give concrete, as was said, short answers, clear short answers. If there are follow-up questions, answer the next question, and so on in a stepwise manner. And the other thing is, it's okay to not know the answer. In some cases, to a question, when is coronavirus going to end? That's when you get to make that assertive statement, it will end, but I don't know when, and that's okay. And sometimes it's okay to say, you know, that's a great question. I don't know the answer. I'm going to go look it up, or let's call your teacher and find out, or let's see what's going on and get back to them. It's less important for children that we have all the answers. It's more important that, because we never do, it's more important that they feel that they have an honest relationship and communication with us, and that it's an open line of communication.
Yeah. No, thank you for that. Lest you think that our audience is just asking about babies or little kids, here's the next one. My son is away at college, okay? My son is away at college. How do I help him being so far away and managing fear about the pandemic or when he has symptoms and that sort of thing? So we're shifting gears here. We're not talking about little kids now. We're talking about adults, young adults. And how do we help them, particularly when they're away from home? Comments?
So one thing is just to let them know that they are still in control there, and that the basic things, hand washing, social distancing, and their mask requirement, which is a little bit tough for the college kids because they want to socialize. College is about making friends, building bonds. It just has to be a little bit different and be creative at this time period. But to just let him know, or she, that they are in control with their own distancing and hand washing. Even if the school offers weekly tests, they still shouldn't congregate and do parties, because what if the test is positive on that following week? So it's always about hand washing and social distancing, and let him know that he does have a sense of control.
Yeah, I really like that, Dr. Moore, this notion of you are, at that age, you are in control. And sort of this personal accountability or responsibility to take take control of their own environment. I like that. Additional comments or questions about that one?
I would just add that it could be helpful to help them, your child, identify resources that are available on campus to help them, virtually or in person.
Yep, great.
Absolutely.
Okay, so here's the next one, and there are probably going to be several. I really kind of feel compelled to read these questions because everyone's got a slightly different bent. This one is, do masks really work, and should I continue to push them on my kids? So you got to, there's a tone of, I'm not quite sure about the masks, and a notion of pushing it on the kids. Do you want to dissuade someone from this point of view in any way, shape, or form?
Well, I'll be extremely quick to chime in that all the evidence right now that we have points to the fact that masks do help. Are they perfect? Well, no. Really nothing that we have in medical science is perfect, but it certainly makes a big difference. So I think between masking and social distancing, it's imperative that we encourage our kids to keep that top of mind as you're at school or participating in activities as the reactivation occurs.
Anybody have a different response? I mean, we're all pretty much thinking, put that mask on, right?
Yes.
No reason not to. So
Absolutely.
in this case, yes, still push it on your child. Here's another one. How do I help my child with loneliness and sadness with missing activities, friends, and interactions at school and extracurriculars? So again, loneliness and sadness that comes with this little bit of the isolation that's being experienced. Comments, reaction, answers?
So I think that it's pretty typical that kids are feeling isolated. I mean, adults are feeling isolated. We're stuck at home, or we're just bouncing between work and home, and it's a difficult time. Everybody's routine is upended. So I think, first of all, acknowledging that to an extent this is normal and it's okay to be feeling this way, right? We're all frustrated, we're all tired, we all want this to end, and it's okay to feel that way. And then second, I think, kind of like Veronica was mentioning when she talked about screen time, quality screen time can sometimes be helpful in this, right? We have technology at our disposal, trying to use it in creative ways to help out with this loneliness, be it Zoom calls, be it Skype sessions, WhatsApp, all these different things that we can do to try to engage in a different way. I know people will have like virtual play dates, you can do games online, like some way to just be connected with people using the technology that we have at hand.
I'd like to add something to that, if
Yeah,
that's
please.
okay. I agree. Validating those feelings is so important, and there are some practical things that we can do to address this. The other thing I would add is when I think about these questions, and when I say these questions, I mean questions that seem sort of impossible to answer. I like to take a piggy bank approach. Every child has a psychological piggy bank, and when bad things happen or distressing things happen, money comes out of that piggy bank. And as parents, we can't always bend over, pick up that money and put it right back in. We can't stop COVID from happening right now. We can't change that our children are getting far less access to their peers than they should or than they need. However, we can put money back into that piggy bank in other ways. And if the bad things that happen affect them as a whole person, then so do the good things, right? So when you put money in, it can help cultivate happiness, and it can give them a cushion or a safety net when money comes out. So maybe your daughter can't go see her friends this weekend, but you can take a nice family hike through the woods or invent a new cookie recipe. And no, it's not the same. And no, it does not solve the problem. Sometimes we can't solve the problem directly, but we can bolster our child's overall well-being by building them up in other ways.
Yeah, yeah.
And then
terrific.
also, as far as that goes, it's a lot of that falls onto the parent too. So we become their social activity and their friends. And from a parent standpoint, that's a lot.
Yeah.
Especially if your home is already compromised with your work. So now you have to work at home, be a play date at home, and still be a mom at home. So one thing that I will also mention is for the parents, we have to find our own peace. Where mine, I found out, was coffee for 5 minutes solo outside brought me energy to go back in for my 6-year-old and 4-year-old who don't understand. So you work today, but let's play, you know?
Yeah.
So that, and then also letting them draw, and I also just being creative. So we did like camping in the living room. So we had the tent set up and then everything. So just trying to be creative with the time that we do have, and to also just calm ourselves down and give ourselves peace too.
Yeah. More mental health kind of questions. I have a 13-year-old daughter who's now very anxious about leaving the house during the pandemic. So we were kind of talking about the opposite a minute ago. Now we have someone who's a little bit afraid to leave the house during the pandemic. What can I do to make sure this doesn't become a problem long term? Thoughts?
Well, I would say this kind of goes back to what Dr. Moore said, which is helping your child to identify where they are in control. So what is in control for them? So there are a lot of things outside of our control, but there are things within our control. How can your child keep herself safe or himself safe? What things, hand washing, masking, social distancing. The other thing is you can help your child prepare for scenarios that may make them uncomfortable. So you can say, okay, if you leave the house or go to an activity or whatever it is, what might happen that has you worried, and how do we prepare for that? Your mask gets wet, what would you do? Someone's getting too close to you, how would you handle that? And you can rehearse that at home so that they're prepared, and just helping your child know what he or she can do when they feel nervous or upset, and then also just helping them focus on what is safe for them. And of course, focusing on the positives of doing whatever it is they're doing, because no one's happy stuck at home all the time, we know that, but it is anxiety provoking. I mean, look, we've spent the last 6 months scaring them.
Right.
Inadvertently, not on purpose, but in order to be safe. And so the other thing I would say is when it comes to activities, there are some things that we need to push on, like school. But if it's returning to soccer and you really want your child there and your child doesn't feel ready, don't push right now. Help, encourage step by step. But it took us, we got hunkered down, we're entrenched, and we have to climb our way out of it, and that's going to look different for different children.
Yeah, thank you. Any additional comments?
Yeah, I think I'd piggyback off that. I think it's meeting the child at their pace, but also trying to help gradually encouraging them to do things.
Right.
Because with anxiety, I think one of the worst things we can do is just let that anxiety drive things and not let them do things that are a little bit challenging, right? That just promotes more anxiety. Again, it's not throwing them into the deep end and just saying, get out there.
Right.
It's meeting them at their pace, but saying, okay, like what are the things that make you nervous? What are the things that are making you anxious? How can we handle those things? And then encouraging small steps and praise for things that they're doing, right? Very pointed, positive praise for when they are making steps, I think is very helpful as well.
Yeah. Gradual introductions.
Gradual introductions,
Just
Say
a
more
little
about
bit at a
that,
time.
Veronica.
I think it's just going, I think to Doctor's point, just kind of meeting them where they're at and even giving them a sense of control. Like if you're anxious about, being in a crowd, what would you feel more comfortable in doing? And let's try that. And being supportive during that and being in tune with them and picking up on their cues. If they're kind of expressing some type of anxiety or they're getting overwhelmed, kind of coming in and rescuing them on some level in order to acknowledge this is how you're feeling, it's okay, offer some reassurance, and then address the situation accordingly if it means, okay, well, we're going to walk away from being in the park if there's a group of people that's approaching us. But at least they have that exposure. And then I think the more they do and realize nothing bad will come of it, then I think the less anxious they can become over time. So it's just doing gradual things.
Yeah, gradual introductions.
Yeah.
Thank you. So here's the next question. And I appreciate this question. I've heard it's okay to play sports outside. Okay, so and we're watching football now on Saturdays. That is not 6 feet away mask activity. That is not. So it's we understand it's okay to play sports outside, but should I say no to my child wanting to play basketball indoors with friends this winter? So someone's planning for the winter events, and one is indoor basketball. What are we thinking about indoor basketball when you're watching football being played outside?
Ooh.
That's a tough one.
Yeah, it is. It is.
And I think it's one of those things, again, that really you have to weigh the risks and the benefits. I don't know if I have a direct, answer for this, this questioner. It's a tough one. I think it depends on, what's the community situation look like? Are we seeing increasing or decreasing rates? And is there a way to safely put on a mask while you're playing? The challenge with basketball in particular is, of course, there's a lot of sweating going on, and then you're touching your face, you're touching the ball, somebody else is touching the ball, touching their face, and that's actually how the virus is transmitted. So I think it's it's a little bit different from sport to sport. Say hockey, unless you're licking the hockey puck, we don't see that transmission taking place as much. So I think it kind of depends on. I know it's a pediatrician response, right?
That we know.
So I really do think it's a very specific situation. It's a very personal question, and it's going to be a tough one that has to be taken on a case by case basis.
Case by case. Anybody feel differently or same?
No, that's the same thing. Plus, with the like we're being indoors, so the ventilation isn't great. And so that's another increased risk. So it's a very tough question as far as who you trust to actually be in that close contact with.
Yeah.
I think that's the other piece too that we've emphasized in the past. These are all personal decisions. These are family decisions. You take the information, you take the guidance, and you make the decision that's best for your child and for your family.
The risks and the benefits.
Yeah. And there are times for my own child and my own family where I balance her mental health, of course it's my orientation, over some risk. And we all introduce some level of risk here. Unless we're all staying in our house, not leaving at all, we're all introducing some risk into our routine every day. And so as a family, as a parent, I think you have to just consider all the information and decide what works for your child and your family. And don't be afraid to make, you can make a decision and then pull back on that decision. And that's challenging, but that's sort of what we're doing right now because information changes all the time.
Right.
Too.
Yep, very fluid.
Yeah.
I'll just add one additional comment. Of course, state mandates do, happen from state to state. In Wisconsin, we are under a state mandate for masking. So if you are playing sports indoors, it's the mandate of the state to wear a mask. And I know it differs in Illinois.
Yeah, it does.
So I
Thank
just
you
want to
for
mention
bringing that up.
Because I do want to be cognizant of
State
that.
mandate, absolutely. So here's one that I suspect might bring you all out of your chair. So here it is. I haven't taken my children in for regular checkups with their doctors because I don't want them to catch something in the physician's office. Am I doing the right thing?
Okay.
Do you want to take this one? We feel both very strongly about this.
Everybody needs their annual checkups because it's the time that we can screen for their development, which is very key right now. And we have to monitor how they are mentally as well. And then vaccines too. So it's very important that you do go in. And Advocate has a safe care promise. So we have enhanced cleanings. We have mask requirements. We have screenings at the door. So we are very cognizant and very respectful to your fear. And we are doing everything that we can to just decrease that particular risk.
And realize that there's risk in not getting those regular checkups.
Very much
what
so.
we do in the office is so critical for health and well-being. We want your child to live well, and to do that, we need to make sure that they're not at risk for receiving vaccine-preventable diseases. We want to get those vaccines up to date. We want to be able to pick up on developmental delays early, get them in, because that is a real issue. We see better outcomes when we have early diagnoses of those. So it is absolutely critical for the health and well-being of the children that we take care of to get them in for their checkups. And I'll echo that safe care promise is absolutely the best thing that we can do to ensure the safety of your family and your children.
Yeah, Kevin, I'm so glad you both reacted this way. I mean, the question, am I doing the right thing for my kids? No, you're not. Regular checkups are the best thing for your kids. And And there is no safer time probably to come to any of our
Right.
Advocate Aurora Health offices.
Right.
All the precautions that we're taking. You should absolutely bring your children in for their regular checkups. And it sounds like we're all in agreement on that one. Here's another question. There are so many mixed messages about whether college students should come home if they're diagnosed with COVID. What do you think? Should stay there, work through it, quarantine yourself, or come on home? I've tested positive, Mom and Dad. What do I do? Do I come home or do I stay?
Again, I think it's situation dependent. In fact, I've been in this situation as a pediatrician overseeing the care of college students, and I will say that it's a case by case basis. Ultimately, if it's safe and there's somebody that's going to be overseeing the health of that college student, stay on campus. Otherwise, you're going to be bringing things home, and we want to make sure that we're keeping everyone safe at home and on the college campus as much as possible.
Got it.
So again, it just depends on the situation, but preferentially stay on campus.
Additional
Yes.
comments?
I will echo that, and then also it also depends on your mode of transportation. Like, how will you get back home? Are you going to expose other
yeah.
people? So
on the
if you're
bus.
going to go
Yeah.
and pick, if the mom is going to go and pick them up, then by all means, because I know that as a mother, sometimes you want to be there, especially if they're boys. Sorry, you kind of want to be there, and so think about that and the exposure rate. But if you can just like stay there, then just stay there.
But if your college student has some underlying health issues that's really going to need to be closely monitored, maybe
Especially asthma.
hospitalizations, then I would recommend maybe in that situation, best to come on home.
Agreed.
And also the emotional support.
Amen. Yeah.
Given the circumstance with dealing with something like this, if they are going to stay on campus, know what the resources are offered through the school. But some kids and families would prefer to have them come home as long as they take the appropriate precautions while at home. There can be something comforting. So it really is going to, depend on the circumstances
know
and
their
those
child
involved.
best.
Yeah,
So, yeah.
absolutely.
Yeah.
To be
Yes.
able to gauge that component of it as well.
Well, and
yeah,
sorry,
please.
can I add? I've got
Please.
this important feeling microphone right now, so I feel like I should say something. And this may seem sort of obvious, but I would add that in the case of a child who doesn't want to come home, just to go back, just to validate those feelings. I mean, it may seem obvious, but it's easy for us as parents to be in sort of go mode, focused on, well, this is what we need to do because this is what's best for you. And that's all true. And we may be doing what's best, but just to take a minute or 12 or 10 hours just to validate, I'm sorry, this is what we have to do.
Yeah.
But I know it stinks and it's not fair.
Just to
and
listen,
we'll get you
yeah.
back as soon as we can.
Yeah. Thank you for that. So I can appreciate this next one because I imagine there's a lot of our viewing audience that might find themselves in the same boat. And here it is. I can't seem to get my teenage daughter to take the risk of COVID seriously. I don't want to scare her, but she's not taking precautions and is participating in high-risk activities with her friends. Is there a good way to discuss it with her? So 13, teenager, sort of that first element of independence and maybe a little bit of rebelliousness, but this notion of not taking the risk of COVID very seriously. What would you advise this mom or dad in your office?
Well, all right, teenagers, dun dun dun. Dun dun dun.
Go ahead.
No, I was going to say, I think it's really kind of appreciating why they're making that decision. And sometimes, especially with that age, it's feeling this lack of control, so I'm going to control what I can. But maybe even starting by asking kind of what is the rationale behind it, given, like, what is their understanding of what's going on, and being able to then appropriately educate them as far as this is why taking this approach is probably not in the best interest of not only yourself but those around you, and also putting in the context of you're not the only one involved. You live at home. Us as a family are going to be impacted if something were to happen. But just starting off with the question, why are you taking this approach to try to better understand? Bree?
Yeah, no, I agree. And I would add, you have to start with the conversation, right?
Definitely.
And I would add that we know teenagers feel invincible. One of the beautiful things about teenagers is that they feel invincible. When I think about being a teenager and some of the crazy things I did, I'm so glad I didn't have that foresight or that that brain that made me think about all the things that were going to happen when I took the dog down the hill on my rollerblades into traffic. You know, it was great. So we have to be mindful that that's where they're coming from and have that conversation. And I think educate and understand that emotions can become entangled in these positions. So acknowledge, even if it doesn't seem like that on the face of it, acknowledge what the emotions are behind it. Talk about how much this stinks, it's unfair, you know, all of that. And I agree with what Veronica said in terms of the outward focus. Sometimes if you feel invincible, it can still be helpful to think about how your actions affect other people. So maybe your child feels very safe and that she's not going to contract anything, or if she does, she's going to be asymptomatic, and probably true. You know, it's statistically, but helping her understand the role that she's playing in the world right now. And I think for all of us, we're all shut down and locked down, and there is this collective anxiety, but there can also be a collective force of how we're helping each other and how we're connecting and how we're helping others. So that might appeal to her.
Yeah, very good. Thank you.
And I think I would just add, just kind of stressing what Veronica and Dr. Roberts mentioned, is that conversation, right? And I think sometimes we think we're having that conversation, but it's more, why are you going out? And it's turned into an argument, and then it's just a lot of conflict.
Right.
Sitting down and calmly being able to express to your child, here are my concerns, here's what, you know, the news is saying, the data is saying, like, here's what the evidence shows, and really kind of having that dialogue back and forth. So I think sometimes we think that's happening, but it's maybe not happening in a productive way. So we really want to make sure, we want to make sure we're really doing it in an understanding way, a back and forth.
Agree.
Excellent points. Next question is not about kids. It's actually about us as adults, and I'm sure we all can relate to this. I now have a compulsive need to disinfect everything. And it's driving my family crazy. Should I be worried?
Raise your hand if you relate.
Yeah. What do you think? What would you say to mom or dad that were in the office and saying, "Hey, before I leave, what should I do here? Because I'm going crazy about compulsively cleaning."
I would say, first of all, that we are all normal people who've been put in an abnormal situation. And when you're put in an abnormal situation, your behaviors change. And it's no different than having scared the kids for the last 6 months. We're all, you know, this is anxiety provoking for everybody. So I would say, first and foremost, the person asking the question has the self-awareness to have asked the question. And awareness is the first step. And so I think with myself, there are things I do that might be strange, and I might understand why I'm doing them, but I might sort of also know that I need to do it right now. So on the one hand, I would say, pick your battles with yourself. Cut yourself some slack. If it makes you feel better to do it and you're not hurting anyone and your hands aren't, you know, bleeding from washing them so much, you know, there's a limit. But then if it makes you feel safer, it makes you feel safer. And on the other hand, if you're asking the question, then I would think about taking the other approach and focusing on what is in place to keep me safe right now besides myself. Like, yes, I do have some control, but what else is going on that keeps me safe, and focusing on the safety that's in place around me, and maybe forcing myself, maybe if there's a note of unhappiness in the compulsive behavior, forcing myself to find time for myself every day with that coffee on the porch for 2 minutes or whatever it is.
Yeah.
Check in with
Additional
myself.
comments?
I think it's kind of like Dr. Roberts said, we're looking at impairment, so to say, right? If it's getting to the point where you're having problems getting to work, you're having problems doing things that you would
Quality of
normally do
life,
in your
yeah.
routine, then maybe it's time to kind of take a closer look at this. But if it's just, you know what, I feel more comfortable, I'm cleaning the home, you know, it's because there's a reason behind it, and that's it, and I feel better, and there's really no impairment. I think cutting yourself some slack, understanding that this is an abnormal situation, and you're coping and you're doing the best that you can.
Yeah.
Put it in context.
Yeah. Context.
Yeah, just put it in context. If it's just in this area that gives you peace of mind and the sense of control, but it doesn't kind of trickle into other areas, or your family isn't giving you feedback about other things, then it would seem reasonable given the circumstances.
If it's isolated just to this, you can kind of...
Right. If it's
Yeah.
causing conflict
Right.
at home, then I think it's time to evaluate
Right.
how maybe to adjust.
agree.
Making people nervous or panic. Yeah.
Right, you don't want to, right, that's a really good point. If the behavior is inciting fear in your children,
Right.
then
That's what I'm.
that's important to look at. Just do it when they're not home.
They're sleeping. I can clean.
Clean at midnight.
Sure. Next question, and frankly, a very good one. Are there any resources available for elementary school age kids with special needs on how they can stay active and involved socially while social distancing? So you probably have perhaps special needs kids in your office that you're caring for. How would you advise this parent? Any resources available for elementary school age kids with special needs on how they can stay active, involved while social distancing?
See, we have a few, but unfortunately right now we have been a little slow to catch up as far as a nation. We've been really reactive to the current situation. What I would say is the American Academy of Pediatrics website, healthychildren.org, is a good resource for parents to look up that. What I would say is, as pediatricians, we've really been confronted with a lot of questions on how we deal with special needs and getting them back to the classroom, especially those that are not able to tolerate wearing a mask. So we've been creative as coming up with, okay, do you have access to plexiglass? Can we be able to create a safe environment where we can keep that social distancing, at the same time have that interaction? Remember, of course, that these special needs kids often really thrive on that social interaction to be able to develop and to grow and to learn and to have that healthy mental health. And to deprive them of that is really going to be costly from a society standpoint. So I think that what we can do is surround these and look for certain situations that allow these kids to be able to flourish, and those types of environments are going to be really key.
Very good. Thank you. Additional comments?
I would, I'm not certain on if there is a good resource on there or not, but I would say that PBS has some really good resources on their website as well, which might be worth checking out.
None of you mentioned the school itself as a source of resources, and I don't know, but I'm curious. Veronica, you were going to comment. Do you think the school might have?
I was thinking that actually is finding out from the school. Whether, classes are remote versus, especially given this population and recognizing the needs, that would be a resource that I would probably actually even start with, perhaps, and they know the child, if, assuming that they've attended the school. So that would be a resource that would come to my mind to look into.
Which goes into the individual nature of each child and what the
absolutely.
special need is and individualized care.
Excellent point.
So the next question is one that we'll all be thinking about here at some point in time. It has to do with a vaccine, and it says, the question is, do you believe healthcare workers will be required to get the COVID vaccine first when it's available? Now, I will say that, as you all know, our policy around flu vaccine is it's mandatory. Our policy around COVID vaccine has yet to be developed. And of course, we're all going to be looking at the data and the research, and because the safety is the paramount focus here. But right now, our position at Advocate Aurora Health is that we will not make it mandatory. This question is a little different. Will we be required? And I don't know, maybe they're talking about by the federal government or that sort of thing. But where are you in your thinking about a COVID vaccine once it becomes available? What's your current thinking? And this may vary, individually. Are you going to stand up first in line and say, "I'll take it"?
Maybe.
Maybe. Tell me about that.
I don't know. I think fear and I guess fear is the wrong word. Angst about this situation is a driver of behavior. I guess I'm the type of person who does want to sort of seize control in a situation where I feel out of control. And so while I don't know, I guess for sure, I think I'm going to look at the data and the science.
Yeah, of course.
I'm going to see but if I feel confident in what I'm reading as a layperson, I'm a psychologist, I'm not a biologist but if I feel confident in what I'm reading, and if people whom I trust in the public sphere are
endorsing it,
and colleagues here at the hospital whom I trust or for whom I have a great deal of respect are endorsing it, I would consider it.
Yeah. How about the rest of you? Any thoughts? I know this is not next week. We all know that. Right. But at some point in time, what do you think? Healthcare workers required to get it first? Do you think that's likely? That maybe?
I think probably it'll be offered to healthcare workers first, at least from what I've read, my understanding
yeah.
from a population health perspective. You know, remember that, of course, this isn't a, hey, we just produced it, can we stick this in your body? It's really going through multiple phases and trials right now. We're on phase 3 trials. So then I think that as, you know, we continue to go with those trials, we get more evidence, we're going to be able to see, are we seeing any side effects? Are we seeing any kind of risks versus benefits? Are the antibodies adequate to provide immunity? So those are all the things that we really need to be answered through the phase trials. And then I think, you know, it gets to the point where the vaccine manufacturers are FDA approved to be able to say, you can now offer it. Then I do think it's realistic that healthcare workers would be offered the first round because our exposure level is higher.
Right, yeah.
Exactly.
We will see how that plays out. We're all kind of anxious about this vaccine and when and those sort of things. So that remains to be seen. We have time for one more question. We're actually running out of time. So here it is, and it's an important one. Is the flu vaccine that's given to a child at a quick care clinic, think urgent care kind of clinic, the same they'd receive in a pediatrician's office? So people are asking, okay, I'm now convinced I need to get my child, myself, a flu vaccine. Do I get it in the doctor's office, or do I go to a quick care clinic and get it? Is it the same vaccine?
Yes,
Right.
it's identical.
Yep.
Identical.
Quadrivalent.
Multiple,
Yep.
multiple manufacturers that make the same vaccine. It's identical.
Same protection.
Identical. That's good, and we've answered that question. I'm stretching because there are so many questions that I did not get to, and I feel badly about that. If we can be quick, we'll take one more. As a parent, what should be our first step once we have identified a significant behavior issue with a young child under 5? As a parent, what should be our first step if we notice it says significant behavior issue with a young child who's under 5?
Go to your pediatrician and talk to them, and also speak with the child in an honest conversation.
Yeah, I mean, I think if you notice a significant behavior problem, if you have a mental health professional already with whom you're already connected, reach out to a mental health professional. If you don't, pediatrician is a really great first stop. And to your point, it may not be a mental health. You don't know what the problem is. So
Right.
I guess I agree. Pediatrician's a good first stop.
Yeah, so seek professional right away, right? Don't
Yes.
wait. Any additional comments?
And I think just thinking about it, because your pediatrician's going to ask, think about triggers, right? So we're saying behavioral concern. What do we think is causing that? Is there something that precipitates it? Because that's going to be valuable to know if we're talking about interventions moving forward.
Or even if there's a pattern.
Right.
Pattern, yeah.
Yeah.
So be
There's a
prepared for
pattern.
those questions.
Yeah.
Okay, we are going to wrap up. You get one comment that you get to make to our viewing audience about this topic today. What would you leave our viewing audience with your final comments? Gabrielle?
Sure. I would leave with some perspective. As parents, we spend our life guiding our children through different things. We teach them how to walk. We teach them how to talk. We teach them how to ride a bike. And for the most part, we're familiar with all those things when we teach that to them. We know how to do it. We are familiar with it. What's happening right now is totally new. This is different. We are guiding our children through something that is unknown to us, that's anxiety provoking for us, and we're just figuring it out as we go. So as parents, we need to extend that understanding to ourselves when we're beating ourselves up, when we're worried we're not doing the right thing, when we feel like we're failing our children. We need to remember we're doing our best. This is all new, and we need to take good care of ourselves.
Very good. Thank you. One comment or one final thought.
Get your flu shot and find you a set of peace, too, whether it's coffee or tea.
Get your flu shot and find your peace. That's perfect.
So I'd say everybody is in a similar and different situation, right? We're all going through this pandemic. There's a lot of stress. I think the best thing as parents that we can do sometimes is modeling positive behavior for our kids. So how we respond to things, our kids are going to pick up on too.
There you go. There you go. Kevin?
So while this may be isolating in an isolating time of your life, you don't need to feel alone. We are here as teammates. We are here to work with you as Advocate Aurora Health. Come talk to us. Come see us. We are your health care providers, and we're proud to be that.
Thanks, Kevin. Veronica?
Stay calm, do your best, and recognize that the situation is unique, and you're not going to have all the answers, and that's okay.
Yeah. Terrific. Thank you all. We're sorry that we're out of time. A big thank you to our expert panelists. We hope this has been valuable to you. That's the purpose of having this program. The Advocate Aurora Health medical community is really second to none, and you've just met 5 of our very best. Please check out our website at aah.org and our social media channels for the latest news and information. We plan to do this again, so give us your feedback. As a reminder, please take that 2-minute time to fill out the survey at the end of this program. And we really want to thank you for tuning in. And until next time, stay safe. Thanks, everybody.